The National Drug Authority's Board Chairperson, Dr. Medard Bitekyerezo, has made the call for improved legislation to contain the theft of government drugs during a meeting with a newly constituted Parliamentary Committee on Health early this morning. This meeting saw Dr. Bitekyerezo take the legislators on a tour around the construction site for the authority's new laboratories in Kampala. According to Dr. Bitekyerezo, this project has been purely funded by the money collected from NDA's verification fees. The committee also toured the authority's current laboratories in Mulago.
Open air, but rather
in deliberations, Dr. Bitekyerezo expressed concern at Parliament's failure to enact the 2009 National Food and Drug Authority Bill. He revealed that the weak penalties in the current law have emboldened some government health workers to engage in the theft of government drugs.
If the drugs of Uganda were being given to Ugandans only, the budget that you appropriate the Ministry of Health would be enough. But brothers and sisters, the drugs of the country are being siphoned out of government facilities by some of the health workers, not all of them, and they collect from Chitoro up to Nimure.
And even when the culprits are nabbed, many of them use their connections in government to escape punishment.
The people who are taking our drugs are Ugandans. They're the ones who steal. So please, in case mafia is bringing me to Parliament for interrogation, I want you to sympathize with us. You should know where we're coming from. And I can tell those fellas are connected. Once you catch him, he goes on a petition the speaker.
He now wants the new health committee to spearhead the enactment of this bill.
Help me and make sure this thing is fast-tracked so that even the food that is packaged that you are eating here is properly sorted. And I'm willing to sort it for you.
For their part, the parliamentarians, led by Dr. Charles Ayume, pledged to assist the NDA to pass the bill in Parliament.
The old National Drug Policy and Act does not encompass diagnostics, doesn't encompass food products, hair products, and all these have to be regulated. It's not only medicines, because a modern day regulatory authority does not only stop at medicines, it goes to food.
They told us one of the challenges they are facing is that most medics are involved in the theft of drugs from the hospitals and selling them in the pharmacies. And yet on some of the medication it's indicated not for sale. So it's one of the challenges they are facing, but they are working as a team to try and curb that situation.
The 2009 National Food and Drug Authority Bill is intended to regulate foods, cosmetics, veterinary products and select medical equipment as they pose a danger to human life once unregulated. First introduced in 2009, the bill has been delayed due to disagreements among stakeholders on critical provisions. Joyce Nakato, NTV Weekend Edition.